everybody, and thank you so very much for joining us. Today is the last two sessions of our webinars on the impact of COVID-19 on seniors' mental health. And this morning, we're going to hear from medical doctor and community people of the new norm moving forward and what we can expect. And I think it should be very good. As Brenda said, please have your questions, and as you think of them, put them in the chat box. And at the end, we will be asking each presenter the questions all together. So first of all, I would like to acknowledge our funders. We'd like to thank the Public Health Agency of Canada for the funding that allowed us to produce these webinars. We would also like to thank our partner CHSSN, Community Health and Social Service Network, for their support with this project. So without further ado, I should mention to you that we did have Dr. Paula Lanvin scheduled to make a presentation. Unfortunately, she's at the Montreal Children's with her son and is unable to join us. So we'll move right along in the agenda, and we have Dr. Claire Godard-Sebillotte, who is an assistant professor at the Division of Geriatrics, Department of Medicine, McGill University, a geriatrician at the McGill University Health Center, as we know, the MUHC, a junior scientist at the MUHC Research Institute, and principal investigator of the team, Research on the Organization of Health Services for Alzheimer's, abbreviation ROSA. Her research interests focus on improving care trajectories of all persons with major neurocognitive disorders using a participatory approach and equity lens. So without further ado, welcome back. We had you last week, Claire, and we're looking forward to moving forward. And what have you learned?
Thank you so much, Ruth. Thank you so much for the invitation. It's a pleasure to be with you today. So when Ruth sent me the agenda and she said, we need to speak about the lesson learned, I am someone very critical. That might come from my French background, but my first reaction was, we have learned nothing. And that came from the fact that I'm working in the emergency department. And what do I see? I see that boxes that used to be used for one person are currently used for two people, two stretchers in a little box. We put stretchers in front of signs where it's written, don't put stretcher here, there is fire hazard. And even old confused patients look at it and say to me, I did not put my stretcher here, doctor. So it's overcrowded in the emerge. We have a staff shortage. There were, over the summer, 2 floors that were closed at the MTH. People were waiting days in the emergency department. In addition, we have a reform of our health system that is going to, independently of whether it's a good or a bad reform, we know that all reforms take people time to implement it. So during the 2 to 3 next years, people will have to understand the new organigram, who is doing what, who is the boss of who is responsible for what. And I'm still reading in the newspaper, very offensive, editorials that I find very offensive, saying, you know, keep your older person at home, as if people were bringing older people for fun in the emergency department. So very, very strange understanding of what's happening to older persons, because the people that I see in the emergency department don't come here for fun. They come here because they are sick and they need our care. And at the same time, some emails coming from the direction saying, could you please not admit people that are going to stay in the hospital as alternative level of care, which means people who actually have had a functional decline during their admission and that cannot come back to home as they were doing before. and that's not their fault. Is just because it is, and they will need to wait for a CHSLD bed or long-term bed. And we receive this kind of emails telling us that we shouldn't admit our patients, actually, because they are going to block the system. And I'm like, no. And actually, we did react with the geriatric division at the Montreal General Hospital, saying, no. Like the patients are not the problem. Like the system is the problem. So that's all the chaos, negative assessment that I do of the current situation. And at the same time, what we've seen during the pandemic is that when we want something, we can have it, even though for years we've been told that we cannot. For example, teleconsultation suddenly was an option when it's been like discussion, negotiation for years and years and years. Will we be able to pay doctors when they don't see in person the patient? And suddenly things opened, and suddenly everything was possible. Same, the government, like the federal government, was actually very generous for workers that lost their job, couldn't work, and suddenly like almost an universal salary was possible when it would never have been in the radar before. So all of that to say that from my critical seeing and other things that I see, I thought, okay, Claire, how are you going to answer Ruth's request to speak about lesson learned from a geriatrician perspective, a physician perspective, and a researcher perspective? I had the chance last week to attend an international conference on geriatrics and gerontology. There were very good speakers there, including Yuen, who is a geriatrician, a researcher, and who's been part of the group that did advise the government during the pandemic, as well as Sophie Zhang, who is a family physician, an epidemiologist, a researcher in CHSLDs and long-term care home. And she's the co-lead of the practice community of doctors in long-term care homes. And both have worked with the Commissaire de la Santé au Bien-être to assess the performance of our system during the pandemic. So I'm going to inspire my talk from these two lessons learned from them, the lesson learned that they identified. I'm also going to ground my talk into my day-to-day experience as a geriatrician, my experience as a researcher. As Ruth mentioned, I'm interested in how we can improve the services for older persons with dementia. And why we did focus on persons with dementia is that they are so fragile that actually each time there is a crack in the system, they fall into it. So they are very good, sadly for them, they are very good signals for us to see where are the problems in our system, where there are fragmentation, non-coordination. They can show us the red flags. And lastly, I did also read a BMJ article, so the British Medical Journal series of articles on the accountability of Canada on its COVID-19 response, where they actually speak about a national shame. So that's a bit my inspirations. So first, and that was highlighted by both Kwok and Sophie, the pandemic made perhaps the general public and our politicians and decision makers see and suddenly understand that there are persons who are older in our society, and some of them live in long-term care homes. So suddenly, older persons were more on the radar, which was not the case before. As we know that the way we did prepare for the pandemic was emptying the hospital to free space for people who would arrive, like a wave of people arriving to hospital, to use ICU beds and ventilators. And actually to empty these beds, we actually did push all these people in long-term care homes, which brought the virus in, and we did not prepare long-term care homes on their own. So yes, first I think that as a society we started seeing in the picture that some members of our society are older, some living in long-term care homes. Sadly, you know, like this prise de conscience was made through the fact that we have one of the worst record regarding mortality during COVID, with an excess mortality in Quebec in long-term care home of more than 60%. When we compare with France, for example, it's 43% of excess mortality. And when we compare with British Columbia, it's 4%. So Quebec's been really the leader in excess death, especially in long-term care homes. And the fact that decision makers and our society as a whole did start to see that some members of our society are older or live in long-term care was linked with investments, and you know all of that. There was more money to train PABs. There was a 5 years plan d'action for the long-term care homes. They have launched the Maison des Aînés. They have reintroduced managers in all long-term care homes. So there has been some movement associated with all of that. And just to remember us from the beginning of the pandemic, I remember someone, you know, like we were all trying to help. And I remember someone from the States writing to me to ask me what are the risk factors to get infected. And I remember that at that time on the Center for Disease Control, US Center for Disease Control website, dementia was not one of the risk factors. And I remember telling the person, you know, I'm very surprised that there is like obesity, hypertension, like some of these older adults diseases, but there was no mention of dementia, knowing that dementia is very strongly linked with all these risk factors. So I was like, I'm surprised. I would add that as a risk factor. And actually now we know that 38% of all deaths with COVID were actually had in one form of dementia. So our blindness was so bad that actually we ill-prepared our hospital and long-term care home, and we even did not think that these people were more vulnerable to the disease. A second thing I think that the pandemic did raise as a problem and raise our awareness on is the fact that we have problem accessing data. And monitoring a pandemic requires data. Assessing our intervention to improve the outcomes during the pandemics requires data. So data is actually central to everything we want to do if we want to be informed in our actions. And as an anecdote, like I can just share that we had with the ROSA team, we applied for a CHR funding, so Canadian Health Institute of Research funding in June 2020. We asked for data for 4 provinces in order to inform our government on the impact of the pandemic on persons with dementia. We were 4 provinces. We were Quebec, Saskatchewan, Ontario, and Alberta. We have been able to obtain data in all 3 other provinces. For Quebec, we still wait for the data that we requested in September 2020. We had other means, you know, to find the data. We were able to give them data, but the data that we formally requested, as it's supposed to be for researchers, we're still waiting for them. So to show you like the importance of the problem. Another thing regarding data was that it took us a lot of time to see that older persons would have different presentations, clinical presentation of the COVID. And actually, I was involved in an article with 2 geriatrics fellows from the MGAs that recorded all the COVID cases in older person. And they were able to show that actually a fall can be the first symptom and the first symptom at presentation. And that's never been the message, you know. We have never heard when someone is falling, even if they are asymptomatic, think about testing them with COVID. You know, that has never been, you know, widespread info on the special clinical presentation of the older population. And even though we know, and that's the core of geriatrics as a clinical specialty, is to know that older person are going to develop the same other diseases, but with different presentation. And we know that that's something we've learned in school. And then there is some loss of knowledge. And when the pandemic happens, it takes a lot of time to start understanding, and oh, actually, they are not presenting the disease the same way as others. So, and you remember like all the challenges and criticism that arose during the pandemic, on the fact that we did not have reliable, timely data on the count of death, on the vaccine coverage, on mortality, and the data. And actually on the Canadian scale, that's been really a challenge. And there is a new law around data access, but anyway, for now, we are still in this situation where access to data is very complex in Quebec. And there are many initiatives in Quebec and in Canada to improve this situation, but it's still the case. And then last thing also on data was how I was stricken, you know, by how it was hard to make information come back from the ground to the decision makers. And that actually, when people wanted to raise an alert and say, hey, actually, everything is a disaster here, listen to us, they sometimes were reprimanded for that, you know. So there wasn't a clear way to raise the alarm, and people that were raising the alarm sometimes could have problems for doing so. So, and I'm not sure we have improved anything on that in our current system. And I was actually attending a talk where people were saying that they can only speak now on the problem that they have seen earlier, because now they are retired and they are not at risk that the hierarchy is going to blame them from what they are saying. So I think that's very dysfunctional. So other things that the pandemic showed us is how ageist we are, how strongly ageist we are, that we had age criteria for vaccination prioritization. We had age criteria for many things, actually. Even though geriatrics and our geriatrics and gerontology teach us that age shouldn't be, you know, a criteria, and we should rely on frailty. They are very good clinical frailty skills, especially developed in Canada by Rockwood. There are also another model in the States developed by Linda Fried. So, but there is a lot of research around that. There is a lot of knowledge that actually aging is a process where you have a diversity of ways of aging. And so it's very different as in children, where you can say between 0 and 3 months, you need to be able to do this, that, and those, which is absolutely not the case in older people. And actually, in my own clinical practice, I never look at the age. And in my teaching, I say to medical students, the only thing that is associated with chronological age is the fastnet that you are typing on your computer. All the other thing, I don't want you to speak about age. Like, and yes, when I'm seeing a patient, revising your case, I never even listen to the age. I might think about the age when I'm going to try to compute a life expectancy. For example, I want to start an osteoporosis treatment, and it might be futile if the person has really very, very few years, you know, to live. But apart from that, I'm all the time just thinking in terms of frailty. How frail is the person? What is their cognitive status? How are they functionally? Are they independent or not? So associated with ageism, we have had all the problems of inequities. So inequities, we've seen that. I'm not sure we've been the best in Quebec to report on it, but many studies from the States came on who showed that actually there was big discrepancy and dramatic differences on the impact of COVID according to your socioeconomic position, your race or racialization. And there were few data from Canada and Quebec, but we knew it was the same thing, even though we have a universal system. So I think that was also something that was put forward a lot. And anyway, I have the impression, at least that Founders for Research have integrated equity into their lens much more. But we will see also. Another big thing was how human rights have been negated and how decisional autonomy has been denied to people. Perhaps one of a good example is the fact that people who are living in résidence pour aînés were suddenly having different confinement measures than others just because they were together. But like they were autonomous. So some of them were completely autonomous, were just living there because they thought that was convenient for them. And suddenly they were like others, like they were different from other citizens. They had others measures. So, and I think we still need to better understand what happened there, how we have so much prioritized the quantity of life over the quality of life, and how we have not let people, make their own decisions. What do I want for my life? What's most important for me? There has been studies showing that actually some long-term nursing homes in the States who did very good on PPE use, on prevention control and all of that, actually had less COVID mortality, but more overall mortality. And I think that we still need to have data on how much these confinement measures had detrimental effects, like on your social, you cannot speak with people, no social interaction, you cannot move, like even very physical, like muscle mass loss, arthritis increase, like, so from very physical to your cognition, your social interaction, and that I think we've been very blind to it. And I'm not sure we already have all the answers on how we should have done and also how we should do in the future. But for sure, I have the impression we need to put people at the center of the decision for their care, which is what we've been told in medicine, what we've been told in school, like person-centered care and all of that. But in the end, that's not what we apply. And in my own personal practice, I think that goals of care needs to be better discussed. The way it's done now, it's because it's not discussed in advance. It's done in emergency department. The person arrived, they are very vulnerable, they are in pain, they are under an acute disease, and I have to ask them, okay, so what do you want me to do if your heart stops? And of course, like it's the worst way to ask it. It's asking questions when you are the most vulnerable, when you think, are they going to abandon me? Why are they asking that to me? Because there is not enough space in hospital. It's like intertwining so many things that actually it's not the right place to ask this question. But at the end, it's also very important questions, because then we have also people that have been undergoing so many procedures and pacemaker and new ICU transfer and all of that. And then they are in CHSLD and they tell me, I'm 96, I cannot move anymore. I just want medical aid in dying. I don't see the point. So I think that as a society, this taboo on dying, this taboo on functional loss makes us very, very vulnerable. It doesn't help us to better discuss all these very important questions. So I think that's been all my ideas and from my inspiration. So I think that the pandemic has highlighted very, very fundamental problems. Did we really learn from them? I'm not sure. And actually in the BMJ article, they were highlighting that at the end of the H1N1 pandemic, we had learned many things. We had created the Public Health Agency of Canada. We had many lessons learned, and that new pandemic arrives and we redo errors. So I hope, you know, that we've learned things and that people will be able to be the actor of their own choices, of their own care choices, that the system will be more evidence-based, but we'll see that in the future. Thank you so much.
Thank you, Claire. Once again, very informative. And I think many of us sitting, listening to you can relate to the impact that COVID certainly had on muscular tone, people feeling they were prisoners, decision-making was taken away from them. I think the one concern we have now as we go into an area and a time of the year when we have a couple of new viruses coming up, the government is probably very aware that people were upset and angry. And I'm a little concerned that they may not keep us as informed as we should be. So I think each one of us have a responsibility to take care of our own family members, ourselves, and exercise the caution that we need to in order to protect ourselves. So once again, thank you very much. And we're going to turn immediately to our next presenter, who was with us last Friday. I was going to come back. She explained what things impacted on the Cummings Center immediately. And now we're going to hear about the new norm and moving forward and lessons learned. And I'd like to introduce to those who do not know her, Brenda Yuen, who is the Director of Programs, Marketing and Communications in Cummings Center. And she has served in this role since April 2019. She came to the center with a wealth of experience working at various management positions for 35 years at the Miriam Home and Services as a community residential manager, an intake manager, and manager of community and work integration services. Brenda has served on numerous community committees, recently as co-chair of the NJHSC and in older adults. Ensuring the support of the older adult community was crucial over the last few years, with the population being impacted from isolation of COVID-19 restrictions. And as Cummings Centers went from an in-person only center to an online only center. Brenda, we thank you extremely much for coming today, because we know you're under the weather. But you've honored us with your presence and it's greatly appreciated. Without further ado, I'm going to turn it over to you, and I'm interested in hearing what you're going to tell us.
Thank you very much, Ruth, for that nice introduction and having me again. Claire, I can really appreciate many of what you were saying, and it was very similar to what I'm going to present as well. So it was interesting to see that perspective just before my presentation. So I just wanted to let you know that Cummings Center is a center that's been around for almost 75 years. We do service people who are 50 years plus. And we are right now, initially we were just serving the Montreal area. And because of the pandemic, we now have reached out virtually internationally and nationally, coast to coast Canada. We have over 300 programs every semester. We do virtual and in person, as Ruth had said. And we also have a wealth of information in our virtual library, which all was very important during the pandemic. So my previous discussion, I had mentioned some of this as well, but for those of you who haven't been, weren't in the first one, I just thought I would mention it again to you. So this is our mission, and I'm not going to go into that too much, but we do touch the lives of 10,000 people annually. And this is because it's not just programs that we're offering. We also have volunteer services, and we have a social service department as well. And all of these were very pivotal during the pandemic. Next slide, please. So our values, they're core to the 3 pillars that I had mentioned to you before. And when I talk to you about programs, it's not just programs, recreational programs. We also have something that's very important, which is the wellness and the adapted programs. And in the social services, we also service a lot of people with mental illness and with dementia as well. So I'll be touching a bit upon that as well, because we did see that there was a huge impact on those more vulnerable people, especially those who had adapted needs. And adapted needs, you could even be something just post surgery, or you could have had a stroke or a heart attack. We also support people who have Parkinson's, or people who have aphasia. So we do really support a lot of these people, and the more vulnerable people were the ones that really were affected by the pandemic a lot. Next slide, please. So the impact of COVID-19 for seniors, these are some of the lasting impacts that we saw. Increased anxiety, depression, fear, and anger. So why do I say that? Well, if we look at it, one of the anxieties that people see is, COVID hasn't gone away yet, as I can attest to that today myself. And also it changes things. We were supposed to have another speaker today. Something happened. I mean, things change all the time because we're still being affected by COVID every day. But people who are older, and especially those who live in senior centers, have a fear again. Is it going to happen again? Are my rights going to be taken away? Am I going to be put into a lockdown, be isolated from my family, be isolated from my friends, literally be kept in prison? And this is a really huge fear of people. It was horrendous. It was being in isolation. They weren't allowed to talk to anybody outside of their rooms. They can only talk to people on the phone. A lot of people at the beginning of the pandemic did not have any virtual access to technology. So, slowly, yes, we were able to get people their iPhones, their tablets. But initially, most of these people did not have anything like that. And then you have to also remember the people who have some dementia, even if it's, they've lost some cognitive abilities, and they weren't able to understand how to use this technology. So it was very isolating. So they have this fear. And the anger. Anger, again, is because they felt that they were treated as second-class citizens. Why them and not other people? They said it was for their own safety, but they were angry that they were not given the choice. It was just something that was put onto them. They were not given the choice of whether or not they wanted to move into another place or if they wanted to go somewhere else. They were just like, this is it, you're in lockdown, that's it, that's all. And one of the things that we found is a lot of the places where there's long-term care, or even just senior residences, one of the major impacts that we're still seeing now is that they're not having the same kind of recreational activities that they had before the pandemic. A lot of people moved to these senior residences because everything was provided for them. If they wanted to have a meal, the meals were available. If they wanted to have laundry, laundry was available. If they wanted to have entertainment and exercise in their own building, it was there. After the pandemic, these people were not getting it during the pandemic. And even now, we found that they were not receiving people going into the building. It's very hard to find people to go into buildings to do exercises and programs for the senior residences. we developed a program. It's not a selling thing, but I think it's so important that you know about this, that we go into people residences. We will provide services for senior residences who can't find art therapists, who can't find exercise therapists, or any kind of other recreational activities. We go in, and there are people that are telling us we have not had any activities for 3 years. 3 years. So what have you been doing this whole time? They go, nothing. We just sit around and talk to each other. Extremely, extremely sad. We've had people we've seen both with us in our own building and in these senior residences that they're not able, they lost a lot of their mobility. They lost a lot of even their functional mobility as their fine motor coordination, their proprioceptive skills, being able to just, move their muscles. And we found that even within just a short period of time, by doing the right kind of exercises, they regained that ability. So one person, for example, who said in his seniors residence, we have him on film, actually, it was really, really touching. He said, I can only hobble a block away to go to the pharmacy using a walker. He said, after doing exercises with you for just a month and a half, I can now walk. Not only that, he says, I can even jog if I want to. He says, it's just that little bit of exercises that was able to promote him to be able to do these things. And you could see he was so proud of himself. He was so proud that he thought he had lost all these abilities. And with just the right kind of interventions, he was able to find them again. So yes, there's a lot of physical long-term effect on people. And unless we address them, they're going to continue to regress. We have to look at identifying these people and helping to support them. And along with that comes a psychological impact with, I used to be able to do this, I can't do it anymore. Now that they once they feel better, they have a better sense of self and also fulfillment. And also by doing these activities together, they are socializing in a different way that they did not socialize before, and they're also supporting each other. So a lot of people as well had anger, and I have this with some of my friends as well, because a lot of people said, this is not the retirement I expected. So when the pandemic hit, some people were planning on retirement, and all of a sudden they were in lockdown. They were in retirement. So they wanted to travel. They couldn't travel. They wanted to go see their grandkids. They wanted to spend more time with them. All that changed. So that was one of the things. Even now, people have a fear of flying because of the whole COVID, being together in a plane. People are worried about flying. It's not the casual laissez-faire way of traveling before, when people who did have money, even people who did not have money, some people saved, their careers in order to go, I don't know, cross Canada in an RV, a recreational vehicle. And all of a sudden they weren't allowed to do that even anymore. So you have a lot of anger anger and also loss of what was expected to be. So you have that. You have the long-term effects of COVID as well that we see with people in our wellness center. We see that people come in who have had COVID, and they have had a lot of muscular loss. They have a lot of pain still. They were told that they have long-term COVID, and it's very hard to identify that. So whether or not it be that or just be a general loss, we have seen a lot of that as well. People living with dementia and mental illness, of course, they have an increased impact. And so this is even more so for seniors. And I'll say one thing, one of the reasons why. We saw that children, I have friends who are psychologists, doctors of psychology, who deal with children. People who were thinking of retiring as a psychologist, they had to go back to business full time because there's so many children that became depressed and anxious due to the pandemic. And that is not the seniors, but those are the grandchildren of the seniors. So of course it has effect on them because the seniors are seeing the effect that it has on their grandchildren. That has a big impact on them. We see a huge resistance to attending in-person programs. We started, as we said before 2020, everything was in-person only at the Cummings Center. We had to switch quickly around to an online only offering of programs, which was a big switch, not only for our members, but also for our staff. We did not do anything virtually before. We literally had, at the beginning of the pandemic, 6 laptops for all of Cummings Center. We had 90 staff. So we had to quickly apply for grants and get those laptops so that we can do the virtual programming. And then we had to teach our members how to access our virtual programs. And we felt it was very important. At the beginning, we were told that we were only to offer essential services. And to the government, essential services meant social services. I argued very strongly for that, saying essential services is not just social services. The general well-being of the seniors needs to be socialization, needs to continue to maintain their health, their mental health, and their physical health. And with a lot of arguments and with a lot of proof, we were able to offer virtual programs to people where we had people saying, you literally saved my life. I was honestly thinking of ending my life because I was so isolated. So what we did was we made sure that at the beginning, at the end of every class that we had, we gave a time for people to socialize and talk to each other. They developed relationships, they developed friendships. They were able to call each other on the phone and have just discussions. Unfortunately, with our present day and age, a lot of the children have moved away from the area where the parents are living. So they don't have that everyday in-person support. When the pandemic opened up a bit more, people were able to meet each other in parks. So we were able to do that. People were able to socialize more. We did walks in the parks, and we made people develop relationships like that as well. Uncertainty of future finances, again, that has an effect because of the pandemic, because people don't know what the future holds. Increased frauds and scams on seniors. It was interesting because just before this session start, there was a discussion about frauds and scams. And it wasn't just on seniors, but we found that there has been an increase since the pandemic on frauds and scams on seniors, whether it be for banks, whether it be for a lot of grandparent scams where people call up, they're able to imitate the voice of their grandchildren saying, I need money, or somebody saying, your son is in jail, I'm calling on his behalf, please send us some money. We've seen an increase on frauds and scams on seniors. We've also seen a push from seniors' children to engage in programs. Now, there's positives and negatives in that. There's an ageism that occurred, I believe, from the children seeing that their parents were so vulnerable that now they want to make sure that their parents are engaged. But sometimes it's to the negative effect because they will say, I want you to be engaged in a program, but it's not necessary that the parents want to be engaged. So they might be pushing them into something that they don't want to. And the other thing is, unfortunately, a lot of people have lost cognitive abilities during the pandemic. So what they used to be able to, let's say they were able to at one time participate in bridge, which is a very hard game actually. It's you need to really have a lot of good, strong cognitive and intellectual abilities to do bridge. And people lost some of their cognition without their family realizing it or without them realizing it themselves. So they would come in and they would say, well, you know, my mom loves bridge, I signed her up for bridge. But the mother would come and she can't do bridge anymore. which is very sad, and we give support. Well, we find that the person cannot do it anymore, which is a loss for themselves because they don't understand why they can't do it, and the family can't understand why they can't do it either, but they don't understand that there has been a loss. You know, it was 3 years. It was close to 3 years where people did not have that stimulation. And that is a big period of time for an older adult. And a huge part of it was loss of friendship. A lot of people passed away. A lot of people lost touch. We trying to make sure that people get in touch again. As I said, we're a community center. One of the things that we wanted to do was to offer older adults a safe environment to be in, where they don't feel that they're being respected and they're not stigmatized, and it's their area to be in. So we're trying to encourage people to come more and more to the center so that they can have that human contact once again. One of the things I did not write about was during the pandemic, there were a lot of grants that were available for older adults, which was very, very good for us. We were able to provide services to people. Now, since the pandemic is wavering, we find that there are not so much grants anymore for older adults. The grants are going elsewhere. And it's not just my organization, but other organizations as well. We found that where the monies used to be focused on the seniors, it's now going elsewhere. So that's unfortunate. It's just like the seniors were the highlight for a few years, and now it's not so much anymore. So it's getting harder to provide services for the older adults. Next slide, please. So going forward, as I said, we have the 3 pillars in the Cummings Center, and I consulted with all my different teams in all the different departments. So moving forward, we're going to continue to provide both in-person, virtual, and hybrid programs and volunteer opportunities, because it really has changed. The pandemic has changed us. Not everybody wants to come into the building. A lot of people are still afraid. A lot of people are still, blaming us because they're saying, well, you're not saying you have to wear masks anymore. Saying, no, it's not a mandatory thing. You can wear masks if you want, but people then are afraid to come in and catch COVID. The positive part about that part is that a lot more people can participate in programs who did not have the opportunity before virtually, whether it be because they had physical limitations and they couldn't come in. The parking around our center is not very good, and the winter, we're Quebec, so freezing rain, snow, whatever during the winter, even our extreme hot temperatures this past summer, if we have virtual programs, people can still maintain their participation. And a lot of people said, listen, if I have a chance to attend a program at 8:30 in the morning, I just hop out of my bed and I can participate in the exercise versus getting dressed, going out, putting on my makeup, finding parking. I just prefer to do it virtually. So actually, by people participating virtually, we're able to, for example, in a room, you can have 20 people. Virtually, in the same class, you can have 120 people. So a lot of people decided they wanted to stay virtually. And a lot of our programs that we have in the evening, people can participate in without worrying about, the fear of the darkness or finding parking or any kind of weather problems. And also our programs now, we're offering them virtually. It's across Canada. We have different organizations that are participating in our programs. So a lot of our programs, for those smaller organizations that cannot afford to do programs on a large scale themselves, they can either purchase programs through us or they can do it through our virtual library. So our virtual library has 300 plus programs. And what people do is they buy access to our virtual programs and they can show it to their organization as a group anytime they want. So if they want to say they're having a yoga class, they can hook onto our virtual library, show our yoga tapes, and everybody can follow that in a group together, even in a gym, in a smaller organization. So those are the things that are some things that did come out good from the pandemic, was that we're able to touch more lives now and support more people through our virtual programs. Our virtual programs also is for people who we have adapted programs as well. So people, again, who have Parkinson's, people who are post-stroke, we do have programs for them as well. And we found that a lot of people appreciate going on virtual because some people are embarrassed. So they don't want to be seen with other people. So there's the grants. We need to look at grants to provide programs and greater access. We have to continue to train other healthcare services, read the needs of the seniors, and be more sensitive to the needs of the seniors. We have to work on the provincial protocols for seniors' residences so that things don't happen again, such as the total lockdown or the lack of services in the seniors' residence during the lockdown. And we have to continue to be flexible, to change our services due to the changing health protocols, whether it be the pandemic or other things that might occur in the future. And I think that's pivotal to supporting our seniors in the future. One of the things that we also continue to do is something called the concierge service, where we're trying to identify those services for people who do have more higher needs than what they were expected. So those are some of the impacts that we have. And I just want to thank you again for this opportunity to present.
Brenda, we thank you because we know that, you're under the weather with COVID, and we really appreciate you giving us the time. And and I'm sure many people online can relate to your comments about the physical impact of COVID that has had on some of us. And I think maybe some of the community organizations have to work together to sensitize the government of the very valuable services that you are offering to the members and to the community, and ensure that the funding is maintained and increased where necessary. So thank you once again. Without further ado, because I want to be able to get to question period. So if you have questions from what you've heard so far, please get them in the chat box, because Katia is monitoring and she'll have them all prepared that when we're finished with our next presentation, we'll go right to questions. And this is another pleasure of mine to introduce our next speaker, Jody Lessard, who I've known for a number of years, who's been a friend of Seniors Action Quebec and has participated in a project that we had back, I guess, in 2018, 17. Jody is coming to us from the North Shore, Baie-Comeau-Sept-Îles region. Jody Lessard is the executive director of the North Shore Community Association for over 20 years and has a great deal of experience with the nonprofit sector, representing the English-speaking minority in the community of the North Shore region, from Tadoussac to Havre-Saint-Pierre and north to Vermont and Shefferville. Jody is well versed in identifying the needs within a rural, remote, and English-speaking community. Having lived in the lower North Shore and being a longtime resident of the North Shore region, Jody is fueled by her passion for understanding the nuances in cross-cultural and language minority communities. From implementing strategic project management methods and developing partnership, she believes is the key to success, which has contributed to some of the recent successes of the organization in the area of community and social development. Jody continues to actively work to develop and maintain partnerships to increase the visibility of the English-speaking population of the region by participating in provincial, regional, and local boards and committees, one of which she is the president of the Regional Access Committee of the Suisse de la Côte Nord. Jody, without further ado, thank you for doing this and welcome aboard. And I'm very interested to hear what's going on in your region because I know that you've been very, very busy. Thank you.
Well, thank you, Ruth, for such a nice welcome. And yes, I've been with the North Shore Community Association since its existence. And as Ruth mentioned in my bio, I'm originally from the Lower North Shore, from one of the isolated communities, and then spent many of my adult years here in the Cotentin. So I think I have a nice idea of the realities amongst our English-speaking communities here within the Cotentin region. So basically, as Ruth had said, the NSCA, or the North Shore Community Association, we are in the North Shore, which is the Cotentin region, and our organization represents a territory that consists of 5 regional county municipalities, MRCs. The other MRC is represented by the Coasters Association, which is a very familiar and long-lasting organization, even longer than the NSCA. So historically, our English-speaking communities is concentrated in the cities of Baie-Comeau, Sept-Îles, Port Cartier, and going to the remote northern communities of Shefferville and Fairmont. And then we do have an English-speaking First Nations in Kawachikamak, which is about 30 kilometers east of Shefferville. So we're a multi-sectorial organization. Our focus is not only on seniors. We work on programs and services in various areas, increasing program delivery initiatives and collaborating on new developments that outlines the needs of seniors, youth, families, health and social services, access. As Ruth said, I am a member of the Regional Access Committee for the Cotentin, the president for probably 3 mandates now. We've also over the years, like many other organizations across the province, we have wellness centers. So this is a programming that permits us to do outreach activities with our senior communities. And for us in the North Shore, we have 2 wellness centers focused into the Sept-Îles community and the Baie-Comeau community, where we see a large demographic of English-speaking seniors, and many of them unilingual. So the level of bilingualism in some communities are quite low, and some seniors really do not speak French. We're about, in Baie-Comeau, we're 1.1% of the overall population. In Sept-Îles, we're about 3.8%. So it just shows you that predominantly it's the French-speaking communities. So before I even go and talk about, the lessons learned and moving forward, what Brenda had mentioned earlier, I was shaking my head and say, yes, I've seen this too. I've seen this too. And, the Cummings Center is in Montreal, and we're totally east from Montreal, and we're seeing this into the regions. Very common, similar traits that we've seen that the impact of COVID has done. But just to go into an immediate impact that COVID had on seniors during COVID. So this is what we experienced. First of all, number one, there was a lack of information in English from the health and social services. Just a lack of information. The bi-weekly, weekly, or even monthly updates that came through the public health sector, because we were all color-coded and we had different measures to put in place. And this was all trickled down by the public health of our regional CIS. And there was pretty much nothing in English, because the Cotentin region, the region that we're in, we have, just going back to the access program, we have indicated institutions, meaning to say that you don't have to have things in English. There's only one area that is a designated institution, which would be the Lower North Shore. So by law, they had to have everything bilingual. So in the Cotentin, in Baie-Comeau, Sept-Îles, Port Cartier, no, we didn't get anything in English, and it was us that was doing a lot of the translation. So that was an immediate impact that had on seniors. It's just being aware of what measures were in place, what should I do, what can't I do, and then just the challenges of finding that. So what happened is we did some research, and what we found is that a lot of the information was being channeled through the PASOC organizations, which is the Programme Soutien Organismes Communautaires. And these were the organizations were doing direct delivery in community health and social services. So a lot of the information, or all of the information, was being funneled through their regional umbrella group, which is called the TROC, the Table Regional Organismes Communautaires. And so we had to reach out to them. We had to tell them who we are, what we're doing, and all this. And we wanted to be part of that email string. So after a while, I did get onto the email string so we can have the information. And then, because we were one of the fortunate regions that we stayed yellow for the longest time, and all of a sudden, we had a couple cases, and then small communities, and the whole community at it, and then we went to red. So during that time when we had a little bit more, I would say, leeway and what we can do, and so we had our wellness groups come in to our activity centers, and so in one particular area, just Setilson, we had such a large group come in that our space was not adequate enough, so we had to separate them, and we had to put the two small groups during the week. So that was extra work for the coordinators. There was extra cost that was involved. So we did see this. The other things that was an immediate impact we saw amongst our seniors is this not being able to understand, how to place an online order through the groceries, whether it's IGA, MUHC, Provigo. So we helped in doing the grocery pickup. We also saw that, yes, less mobile amongst our seniors. They were not getting out. They were scared. They were even, they just didn't want to get out of their house. And this is a long-lasting impact because we do see this today. Mental health issues and anxiety levels rose. Yes, many were angry. Many were angry because they didn't understand what was going on. There was little to no information in English. Social isolation amongst seniors that increased. The fear of going out and being in crowds. The fear of going to the pharmacy to pick up your medication. The fear of going to the grocery store to get some groceries. They just did not want to go out. So we saw an increase in social isolation amongst seniors. And then we had, because there was no services out there for the English-speaking seniors in our community, we were known to be the go-to organization to help out seniors. So we've reached out to seniors that we didn't even know existed. Okay, so our membership or our listing did increase, and that was something positive that I would say that the COVID had done, is because it made us more aware of other seniors that are out there, and also made us more aware of the needs that these seniors had. So we had an increased list of shut-ins and respite care. We are fortunate to have a long-lasting program through Appui that we do respite care for clients that have dementia or Alzheimer's or Parkinson's. So that list increased a slight bit, so we were more aware. So we were fortunate to receive a little bit more funding in order to do more hours for that. And because we were the go-to organization, we had to be a little bit innovative and try to keep the wellness activities going. So we went to the virtual mode, and we did online games, bingos, social teas in the after hours, trivia, all these fun things, because what the seniors wanted, they just wanted to socialize. They wanted to interact. They wanted to talk to each other. But that being said, we did have some seniors that were not so less technical savvy around using a iPad or a tablet. So we were fortunate to get some iPads, and we were fortunate to have some volunteers in the community that would go and just do a little troubleshoot, set up their Zoom so they'd be able to interact. Also, we saw an increasing need of around technical support for seniors to be able to do the online registrations for vaccinations. We had seniors that didn't know how to navigate the CIS site, didn't know how to go about in booking their vaccinations. So we did a lot of outreach and support around there. So these are just some of the impacts that we saw and had happened during COVID for our region and amongst our seniors. Well, lessons learned and how did we move forward? So lessons learned, number one, is I have to be part of this communication string. I need to be more aware of what are the rules and regulations when it comes around public health. And so we got to be a member of the PASOC. Because we're not of the truck, because we do not receive funds, because we're multi-sectorial, and according to the reference that we cannot apply because we don't have a specific mandate around health. So we became an affiliate member in order for us to be part of all the communications that the CIS goes out. So we don't miss anything. We don't miss the boat on anything. We're much aware. So we did become a member of the truck, and now we receive everything from public health, and sometimes I get it in triple and double. The other is that because we are a truck, we've also reached out to the truck to help to advocate for us, to see if there's any possibility if we can get any specific funding under the PASOC envelope. So, and specific funding for our seniors, to do more outreach for seniors. So that being said, I guess the pandemic did increase our awareness of the seniors out there that need more help. We have a list of seniors that receive friendly visits. We have volunteer seniors en route. They remember the program we did way back in a GPS program that you were talking about, getting programs to seniors and developing that volunteer base. Well, it's still going today, route. And we do have volunteer seniors that are reaching out and doing friendly visits and check-ins with other seniors. We have acquired a little bit of funding to help to coordinate that, so which is good. And our respite services, the hours have increased. And now with pandemic, we're seeing more of a need. We're seeing more need of Alzheimer's, dementia, and other psychosocial diseases. And then the mental health and well-being, which was very important and was much identified amongst our seniors of what was needed. We during the pandemic, we organized walking clubs. So Thursdays was walking day, and it was the way to get them out. So since the pandemic, that has been still going on, and we have Tuesdays in Settles, Thursday in Baie-Comeau, where seniors are out walking about. Sometimes there's 5, sometimes there's 10, but it all depends. But at least they have something that they can socialize and get out and be more mobile and walk about. We've also introduced yoga classes. And I know that the Cummings Centers has this virtually, but what our seniors has told us is that they wanted more of face-to-face activities. They wanted to interact. They wanted to talk to each other. So we've done that. We've offered yoga classes. We even offered Tai Chi in one community just to get them more mobile. They told us that the COVID-19, the pandemic, has made them less mobile. And also we've seen that the social isolation part, some seniors it's taking them longer to get back into the routine and getting out. That fear is still there. So we don't have them 100% back. They're slowly weaning back into getting into the routine and coming out to our wellness activity, but there's still a fear factor in some seniors that we're seeing. We offer book clubs. It's another way. So they come out and they discuss the book club over a breakfast. And we also offer sessions or any like information sessions, tips and tricks, resources around anxiety, depression. We've been working very close with our CIS to make sure that they're all in English. And so working with also some community partners. So that these are topics that has been identified and addressed by the seniors that they want to have more information or more resources on. The other program that we recently have started is around digital literacy. We're doing a digital literacy program, and there is a component for seniors, and the digital literacy program is to give them support in technology. Support in technology is offering the iPad tablet 101 learning again. So there are some seniors that we did not reach, new seniors that have come out and joined our activities. So we're offering this service to them. We're also offering in our offices Tech Tuesdays. So if there's a senior that wants to come in and doesn't know how to navigate the health system and making an online reservation appointment for a vaccination, or even anything through Services Canada for, or Revenue Quebec or something, we're there to help them. We have a support system in, and we're also offering workshops on information sessions about, red flags when you see talking about scams and frauds and online banking. And there's still the fear yet that, they just don't want to do the online, don't want to do the online programming. So this is a lesson learned that, that we saw during the pandemic and how we're moving forward onto it. And I can say that, the pandemic had a lot of negative impact, but it did have a positive impact for us. And the positive impact was that because during the pandemic, we got to be known, the English-speaking organization that's going to take care of you because there's a language barrier, or you don't know what's going on, call the NSCA. They know what's happening. So we've have an increase of seniors attending our activities, which now requires us to, in one community, to have a larger space. So now we have a problem around finding financing in order for renting. So we do need to increase our space and also increase the space just in case that, we have to implement physical distancing again. And if there was to be another pandemic, or just because we know flu season is coming up, so we should, keep the distance. The other positive I would say is because I make sure I advocate here in my region for the English-speaking community, and I'm there and I'm talking about the English-speaking community all the time and the needs, is that we have an increased visibility amongst our community partners. So those that are Francophone partners and also public partners. So now they know who we are, and so we're a little bit, we're not on the back page anymore. We're coming, we're in the middle, or not on the front page, but we're not on the back page anymore. And there's something that I think, Ruth, I know there's probably another series of webinars, but there's something that I feel that, which is very important, and it's something that Brenda touched on, and it's talking about greater access to programs and financing. During the pandemic, the full focus was on the seniors. It was like, okay, it's the poster group. We're going to have all these programs in place for seniors, and then we sort of, we fell off the page, and like that group, there needs to be more programs and financing offered for senior outreach. The other thing is that the public health sector has to realize that there are English-speaking communities out there, and you can't rely going through the program, the PASOC organizations and thinking you're going to reach the whole community. They have to make sure that they reach out to these community organizations and get the message to them, get the communication to them, and so they can get all of that to the English-speaking community. And that, you know, the government itself needs to understand that in Quebec, especially in the regions, that there are English-speaking communities. There are seniors that do not speak French or have little French, and there are needs out there. So I'm checking my time here, Ruth.
Yeah,
I know we're coming up. So I just wanted to give you, a recap of a regional view, and where we're very, very small pockets of English-speaking seniors into a very large Francophone community. And it's all about access. It's all about, you know, having services in English, and just for the government to advocate to the government that, hey, we're out there too, and you know, we're Quebecois also, you know, we're the English-speaking Quebecers, but you know, we're citizens of Quebec. So that being said, Ruth, I'm
Jody, you did marvelous. Thank you so very much. And it warms my heart because you know that I'm a mainland girl from birth, and I've always been particularly partial to mainland Quebec. When my job at Alliance Quebec, I spent 7.5 years getting to travel to your beautiful regions, and I certainly can relate. You explained it beautifully, and yes, your needs are as bad as, if not worse, than what we have in Montreal, because at least in Montreal, there's more of us. So I thank you. Now, without further ado, because we are pressed for time, I don't, Katia is going to handle the questions. Then I'll come back and do a very brief wrap up and thank you. So Katia, did you get any questions?
No, but I jotted down questions, so hopefully I can read my own scribbles here. So I'm just gonna wing it. But I know
we got time for about 3.
Yeah. I know Claire has to leave in about 5 minutes, so I have one question for Claire. And so you were saying how dementia was tied to high risk with COVID, but no one kind of knew about it. So that blew my mind because I was one of those people. But then you also said how sometimes a fall could be a symptom of COVID, but it could be masking something else. So if you could just talk a little bit about that, and if you know of any resources or websites where people could find more information on that, because this is the first I've heard of it.
We wrote an article on the initial clinical presentation of persons with COVID at the Montreal General Hospital in the Canadian Journal of Geriatrics. And many actually presented with a fall. Regarding the association between dementia and COVID, I think that we're at high data. I can try to look and write in the chat the reference during the question period.
Okay, thanks. And I know you got to leave, so I won't stretch it anymore. I have so many questions, but I'm going to let it go. Jody, one question for you. I have so many, but I'm going to narrow it down. I'm going to try and squeeze 2 together. But you were talking about how during the well, are we still in a pandemic? But I don't know. During the height of the pandemic, you know, your organization had to do a lot of translation services, and you know, you had to help seniors with their vaccination appointments and things like that. So my brain immediately goes to how are your seniors now, and how is your staff that has to take care of the seniors? Because it kind of sounds like your workload went, which is a good thing, but how is everyone doing now that seniors know who you are and you're going? But how's everyone doing, and how are you doing?
So first of all, we're doing fine. I've managed to increase my staff, so I have more staff on. So, and I've also hired a manager. So I've taken some things off of my plate. So yeah, we're doing well. We're doing well as in staff, and I think for us here in the community, it's part of our passion for community work. You know, we do this, but we always go the extra mile because these community members, and that's one thing about being in a small community, is because we know everybody. And sometimes it's the aunt of so and so or the uncle. So I think it's a closer knit community. So you know, we go that extra mile, and for us, I've heard my staff saying, like, feeling very appreciated when the senior would come and say, thank you for doing this. You know, you don't know how much stress you took off my shoulders. And just hearing the thank you, I think that the staff really appreciate it. So, yeah.
Hooray, I guess, if that's the right term. And Brenda, I have one question for you. You were talking in your presentation towards the end about the push from children to get their parents engaged. I think I'm guilty of that with my own parents. Or kind of maybe subliminally or subconsciously. So I was wondering if you could maybe talk about that, because I think a lot of people are doing it just with themselves as well. For example, I had to go on a plane this summer, and and I've never been afraid of flying, but I had that moment of, I'm not wearing a mask. And I was like, it's okay. You're getting out of your comfort zone. I just saw Ruth's reaction. But if you could just speak a bit about the kids kind of pushing their parents to kind of get back out there, right?
So it's a good thing and it's a bad thing. It's a good thing because people are thinking more about their parents and their needs, which is a good thing. The more challenging thing, though, is sometimes I wonder where it's coming from. Is it because they're guilty? They feeling guilty that they're not doing enough for their parents? Or is it because it's really something that they want their parents to do and they feel that they need the support? The problem is that often they're not respecting their parents' wishes themselves. So they might sign them up saying, okay, mom, I signed you up for an art class. But maybe there's other things that the mother would like to do instead. There's other programs that are, might be interesting. And they have it in their head, well, my mom used to do art, so she'll probably want to do it again. But they don't necessarily ask themselves, what would you like to do? Here are some of the things. Well, so what we're trying to do now is we're trying to ask people, why don't you have your mother contact us? We would like to speak to your mother directly. It's a matter of respect and dignity, but it's also maybe your mother doesn't know of all the different programs that we have. We have many different programs. She'd like to maybe have different opportunities to learn something new instead of something that she used to do in the past. So there's a lot of different aspects to this. I think it's great that children are more invested in what their parents are doing, but I think sometimes there's an unrealistic expectation of what they should be doing or what they want versus what they want to be doing and what they're able to do, what they're cognitively able to do, while having a feeling of fulfillment, because it can be very discouraging to go into something that you used to be very good at, and then all of a sudden you realize you can't really follow what the teacher's doing and you're not able to do it as well as you used to be able to do. Instead of maybe going to something new and learning something different, where you might be able to learn a new skill and even feel better of yourself. So there's many different components to it.
And I'll toss it back to you, Ruth. Thanks, Brenda.
I think for the sake of time, we could go on and on, but Claire, Brenda, Jody, thank you ever so much. This has been most informative. I'm going to ask Claire if she can send me the links to the websites, and I will ship it out to anybody who asks me for it. So just email me. Just to wrap up, I would like to remind you that there is a Survey Monkey that we would like you to complete and get it back to us. And I encourage everybody, and please complete it. It won't take a lot of time. It's for our funders, so we need that data. And anybody who's coming back for the afternoon session that you registered for, it will be the same link. So we are going to shut down, and we will come back at 1:30 and start the next session. And we'll be hearing from a doctor and what still needs to be done with the healthcare system and their new norm, and also from Sam Watts, who's the CEO of Welcome Hall Mission, and what they're discovering and moving forward with housing and more seniors being homeless. So I think without further ado, it's like almost 12 o'clock. I thank you very much. And I hope you've all enjoyed it, and we'll see you at 1:30 if you're scheduled. And oh, I should acknowledge we have Agape Wellness Center. We have coasters on the line, and I do appreciate you bringing your people together and coming on. And on a sad note, our thoughts are with the people.